So much was said, and then there was a lot that wasn't said, right? Joining me right now is Dr. Lipi Roy, physician at Greenwich House in New York City. Dr. Roy, great to see you. I mean, to convey to people that you have cancer is very personal, and it is a lot. But what did you read in the princess's demeanor, the information that she was willing to share, how that kind of filled in some of the blanks in terms of so much mystery surrounding her condition?
Yeah, good to see you again, Fredricka. I wish under more joyful circumstances. My initial reaction, like most people, was shock. We don't typically expect a young, otherwise healthy, active person to get a diagnosis of cancer. And to most people, look, any medical diagnosis can be stressful, but the cancer diagnosis still remains quite harrowing for most people. In my line of work, I'm not really surprised. I unfortunately see these kind of diagnoses in young people. And as somebody who's cared for many patients with cancer, and even personally, both of my grandparents died of abdominal cancers, in their case, colon cancer. I think it's really important, though, Fredricka, for the public to recognize that preserving Princess Kate's privacy right now is really going to be important in terms of her recovery, in order for her to make a full recovery. I did feel when I saw the video, she didn't look that well. I saw pallor, like paleness face, a weight loss. She was already a very thin individual, but it seemed like she lost even more weight. Again, a lot of this is very common in cancer, in malignancy. Cachexia, weight loss is very common. This could also be side effects from the chemotherapy. So there's a lot of unknowns, but as a physician and as a fellow human being, I'm certainly hoping for a full recovery. And I hope that our young family is coping as best as possible too, Fredricka.
Yeah, I mean, you mentioned your family members, in their bouts with uh, you know, abdominal cancer, you said, or abdominal surgery?
Yeah. They had abdominal cancer and
Right.
surgery. In their case, it happened to be colon cancer.
I
Again,
see.
as you know, Fredricka, we don't know the specific
Right.
diagnosis for Kate, but we have clues that it's in the abdominal cavity. But as you know, there's multiple organs there, and cancer is not one disease, it's multiple diseases. And so
Right.
a cancer of the liver, pancreas, uterus, the ovaries, completely different diseases that warrant different treatments and have carried different prognoses, Fredricka.
Exactly, and that's exactly what I want to underscore, because it could mean, a gamut of things. And while everyone wants to
Yeah.
respect her privacy, do you believe it might have been helpful, especially in a public awareness kind of way, to know with some kind of specificity what in the abdominal area? Because it is very helpful, that she is delivering this message of, if you are dealing with cancer, just know that you're not alone. And then I wonder if, taking it a step further by being more specific about what in that abdominal area, because as you say, the treatments will vary accordingly.
Yeah, you're absolutely right, Fredricka. So as I pointed out, the different cancers have completely different treatment strategies. It depends on what stage they're caught. I'm hoping that it was caught early. They did the surgery. I'm hoping that maybe they surgically removed. And as Kate mentioned, she's undergoing chemotherapy, adjuvant or preventive chemotherapy. And the purpose there is the intention for adjuvant or preventive chemo is to really remove any remaining or residual cancer cells, clusters. So the intent is for cure, or to increase the chance for cure. So I am hopeful. The other thing I'm really hopeful about here, Fredricka, is that, as we pointed out, she's young. 42 is
Yeah.
actually really, she's young, she's active, she's otherwise healthy. So these are all positive, what we call prognostic factors for Kate. But to your point, Fredricka, yeah, for us, it will certainly be helpful.
Yeah.
But to Kate's point, she did recognize and acknowledge that millions of people around the world have cancer, and they are all kind of struggling and fighting, and they should remain hopeful. But really, the key is getting a prompt medical attention and having a really strong support. And it
Yeah,
sounds
good
like Kate
network.
does have.
Yeah, indeed.
Yeah,
Well, Dr. Lipi Roy, thank you so much. Glad you could be with us again.
of course.